Chris Estes, President and CEO of the National Housing Conference here in Washington, D.C. Thank you for joining our annual Budget Forum webinar. For those of you who've been around NHC for some time, you may notice this is the first time we have done the Budget Forum as a webinar. We did this to make this information more readily and easily accessible to folks around the country, as well as to make it easier for Hill staffers to participate. We are excited to report that we have over 400 folks registered for this webinar, with 220 on the phone right now, and over 50 of those as Congressional Hill staffers. So we're particularly excited at the number of folks who want to get this information and hope it will have an impact. Today's program is really designed to not simply discuss the budget numbers, but to really give you a context for them. Ethan Handelman, who is our Vice President of Policy and Advocacy here at NHC, is going to frame the sort of budget process itself, how budgetary decisions are made and sort of where the budget process goes from the President's initial budget. Dr. Lisa Sturdivant, who is our Vice President of Research and Director of the Center for Housing Policy, will help make the connections between how housing programs and access to affordable housing have an impact on education and health and other sort of community well-being factors, to help people understand sort of why these programs are so important, and to help you as practitioners and advocates really understand how to communicate more effectively about them. We are pleased to have Laura Hogshead, who is Deputy Chief of Staff on Budget and Policy for HUD, here with us today in person, who will be talking about some of the significant changes in the HUD budget, particularly from last year. And then we'll hear from a series of 4 speakers who are practitioners out in the community, who will talk about what these programs mean for the work that they do. You'll hear from Gary Heidel, who's Chief Placemaking Officer at the Michigan State Housing Development Authority, who will be talking about the work that they've done in Michigan and how important housing has been a part of their economic recovery. You'll hear from Roseanne Haggerty, who's President of Community Solutions, who will be talking particularly about housing funding that affects ending long-term and chronic homelessness, as well as homelessness for veterans. You'll hear from Richard Gentry, who's Executive Director of the San Diego Housing Commission, who will be talking about how the budget impacts public housing and some of the innovative things that San Diego Housing Commission has done in their region with public housing and trying to serve extremely low-income households. And finally, you'll hear from Lindemann Delaney, who is an NHC board member and also president of Eden Housing in the Bay Area in California. Linda will be talking about how, as a nonprofit developer, she has used funding from the HUD budget to produce affordable units in an area that is struggling mightily with affordability. So again, thank you for being on the call today and participating in our webinar. We look forward to engaging all of you going forward from this, and hope you are able to take advantage of more of these educational opportunities from NHC. And with that, I will turn it over to Ethan Handelman, to talk about the budget process.
Thanks, Chris, for that introduction. Just as framing for today's conversation, let me set the context for the budget process and what we're looking at from a housing perspective. I think the best analogy for thinking about this is in the context of a series of waterfalls, right? And we have 2 slides here that kind of walk through it. The first one starts at the very top level. Think of it as the big budget waterfall, where we start with total discretionary spending. That's all that Congress gets to make choices about on a year-on-year basis. It leaves aside all of the mandatory spending and interest payments on the debt, which together are bigger than discretionary spending. They're way bigger. But this is what Congress is working with. It's called technically the 302A allocation. That's the size of total discretionary spending. That gets divided up into several different subcommittees of the Appropriations Committee, each with their own area that deals with different branches of different parts of the government, different agencies. The one that concerns us today is the Housing and Transportation Subcommittee, and it gets what's called technically a 302B allocation, right? Its piece of the 302A pie. That Housing and Transportation Subcommittee has to deal with both housing, right, basically HUD, and the transportation budget, and we're no longer in an era where the transportation trust fund, right, funded by the gas tax, funds all the transportation needs. They need appropriated funds too. So there's a battle even there before you get to housing, which is then the next waterfall down to HUD's budgets, and that defines the 40 or so billion dollars that HUD has to work with in a particular year. That leads us to a second waterfall, and this is where it starts to get really difficult, because the first step you take is a Niagara Falls, right? 84% of HUD's budget goes to just renewing existing rental assistance. This is for housing choice vouchers, right, the mobile Section 8, for public housing, for project-based rental assistance, project-based Section 8, and for homelessness programs. That's just keeping the people who are currently assisted, which is both a political necessity and a humanitarian necessity. But that consumes a huge majority of HUD's budget. So the next step in the waterfall goes to what I've originally called everything else, right? Home, CDBG, Section 202 housing for the elderly, Section 811 housing, HOPWA housing counseling, choice neighborhoods, you name it. The list goes on, and I didn't list anywhere near everything here. But it's all fitting into that last 16%, which means when cuts happen, as they have in the past several years, then the cuts come out of that 16%. It's very difficult to cut existing rental assistance, although there's compression in those programs too, and we'll talk about that. But the cuts come in the remainder, and that's why home and CDBG are in big letters, because they're the biggest chunk of this, and they're the ones that are most vulnerable. And in fact, over the past several years, that's where we've seen the cuts hit very hard. So when we're thinking about our advocacy around housing and federal supports for housing, we have to think back to that big budget waterfall, right? The best way to make sure that there's enough funding for whatever particular program you are working with is to make sure that 302B allocation is as big as possible, that there's as much for housing and transportation and from there to HUD as possible, so that you don't have to see the painful cuts at the expense of all the programs that aren't existing rental assistance. That's why NHC is advocating at that level. We do it through the Campaign for Housing and Community Development Funding. We do it through the Non-Defense Discretionary Coalition, and we encourage you to do the same, because it's when our voices are raised up together and in large, diverse groups that we can have a real impact. If we wait to the end, if you wait to that last waterfall to advocate for your specific program, all it's doing is trying to eat everyone else's lunch, right? 202 is trying to eat a little bit of CDBG to keep itself going, or housing counseling is trying to elbow aside something else to keep its funding going. But when you're down to that level, the only lunches left are peanut butter and jelly. There's nothing there. So we need to make sure the top level funding is as large as possible. When you think forward to what to expect for this year, expect a lot of political battles over sequestration, right? The automatic spending cuts required by the Budget Control Act. We've already seen that discussion starting. We are coming off of a 2-year period where there was an agreement to suspend those caps. Even so, even if we achieve that again, even if there manages to be a bipartisan compromise again, it's not going to mean a large-scale increase in resources, right? It's going to be avoiding even more painful cuts. That's why the early advocacy is so important, and that's what I've been talking about with the CHCDF Coalition and the NDD Coalition. All of those are the way to really make some change. You will also see compression at the program level. We've already seen a lot of this with things like HUD sweeping the residual receipts for the properties it could. We've seen limitations on the payment standard. There's a proposal now to reduce the vacancy payment standard for project-based Section 8. We've seen incremental cuts in the voucher program, sort of non-renewals as vouchers turn over. All of these are painful and are just around the edges. HUD is doing everything it can, which any responsible agency would do in an era of austerity, to be as efficient as possible and to work within the budget it is given. But it's on us both to advocate at the bigger picture for more resources and also on specific changes to make sure that they are done responsibly and in ways that are efficiency creating and not damaging. Also expect to see some monkey wrenches this year, some surprises that make the conversation potentially more difficult. If you remember last year, the predictions for FHA receipts came in very different between HUD and the Congressional Budget Office, which ultimately limited how much offsetting revenue there was to help HUD's budget. This year we have the bright side that the National Housing Trust Fund and the Capital Magnet Fund are looking forward to funding flowing next year from Fannie Mae and Freddie Mac to help affordable housing. It does create a bit of a challenge with the Congress, though, to make sure that they understand that those resources are really just complementary to existing resources. In a state of the world where only 1 in 4 of folks who are income eligible for housing assistance actually receive it, we would not want to be in a situation where resources on one side, say the Trust Fund and the Capital Magnet Fund, make it easier for Congress to cut resources on the other side, say home or CDBG. So that's, I think, a real messaging challenge for all of us. And also expect to see negotiations over the debt ceiling, create some real partisan-style battles. After all, we don't even have full-year funding appropriated for the Department of Homeland Security yet. There are a number of these type of partisan spending battles that will happen during the course of the year, and our challenge as the housing community is to make sure that we don't let housing get swept up in that it is seen as a positive sum investment, something that benefits the community as a whole, and one that is worthy of increased support from the Congress. So to help us progress in that vein, I have the pleasure of introducing Lisa Sturdivant, who is NHC's Vice President for Research, also the Director of our Center for Housing Policy, and she can give you just at least a taste of some of the research that shows what kind of a positive sum investment housing can be.
The goal is really to build on the stage that was set by Ethan and Chris for the conversation we're going to have about the importance of federal housing programs. It's also a chance to broaden the understanding of how housing affects the lives of individuals, of families, and of the communities in which these programs operate. Research has consistently demonstrated that stable and affordable housing serves as a platform for a number of measures of well-being, health, education, economic self-sufficiency. What the research finds is having a safe and affordable place leads to positive health outcomes, positive education outcomes, as well as with greater opportunities to pursue economic opportunity. Unfortunately, for many lower-income families, safe, decent, stable, and affordable housing can be difficult to find. In our most recent version of Housing Landscape, which we'll be releasing next month, we found that 25% of low and moderate income working renters in America are severely cost burdened, meaning they pay more than half of their income on housing costs. Other families live in unsafe neighborhoods or in locations far from their jobs. Federal housing assistance can be the difference for many families between having affordable and stable housing as a platform and facing tremendous obstacles to improving their opportunities. In addition to improving outcomes for individuals and families, providing stable and affordable housing can actually save money. And these cost savings have been most often demonstrated in research on housing and healthcare costs. For example, a recent study of permanent housing in Oregon for formerly homeless adults found that Medicaid expenditures for those residents declined by 45% over the course of the year after they were provided with permanent housing. Other research found that Medicaid spending on long-term care services delivered through home and community-based services achieved average savings of $44,000 per person compared to providing those same services in nursing homes or in other institutions. And in San Francisco, a recent study found that children in non-redeveloped public housing were 39% more likely to visit the emergency room than children living in a Hope 6 project in that same city, saving the public health insurance system money. And when ER visits average between $2,200 and $2,500 a visit, you can see how this can save money to the Medicaid system. Benefits of affordable and quality housing accrue to children, and positively impacts their educational outcomes and ultimately their economic opportunities. What we find when we look at the research is that children who live in stable housing means that they move less and they actually do better in school, and the school systems do better as well. Research has also found that households with lower cost burdens, where families spend less than 30% of their income on housing, often spend more money on educational enrichment activities for their children, which can help them succeed in school. The research has shown that children living in low-quality housing have greater emotional and behavioral problems, including anxiety, depression, and withdrawal, compared with children who live in higher-quality homes. And the research has consistently shown that children who live in overcrowded homes typically complete less school than children who live in uncrowded homes, and typically about a quarter of a year less school. So the evidence linking affordable housing and housing quality with school achievement has been very well documented in the research. And students who are better prepared academically are able to be more productive as adults and to have greater economic opportunities. Finally, access to affordable housing has been shown to more directly impact economic well-being of individuals and families through several means. Some really interesting cognitive science research showed that urgent financial concerns, including concerns around being able to afford housing, can lead to cognitive impairment equal to about a 13-point decrease in IQ, which means that it reduces the ability of individuals to make strategic economic decisions, which can be beneficial to their families. And so by reducing those financial concerns, parents and other individuals are able to make better economic and financial choices. Studies of Job Plus participation have consistently shown that that program increases earnings. One study showed that over 3 years, participants in Jobs Plus earned about $1,100 more compared with folks not in the Jobs Plus program. Similarly, the Family Self-Sufficiency Program has demonstrated that FSS graduates increase their earnings by 135% compared to 26% of individuals who don't participate in the FSS program. And finally, as we know, affordable home ownership can be critical to helping lower income families build wealth. These highlights from research on the intersection of housing, health, education, and economic well-being provides just a snapshot of how investment in housing pays dividends. I hope you'll visit our website to find more research reviews demonstrating those links under the Housing Intersections part of our publications, where we have research syntheses and analyses that demonstrate these findings. I want to thank you very much and for your time, and I will turn it back to Ethan.
Great, thank you, Lisa. For folks who are interested, I saw we had a question through the webinar. There will be an email that goes out to all the registrants, which will have the slides from this as well as a link to the recording. So if you feel like you missed anything, don't worry. You can always go back and print stuff out. And on our website, you can always access all the publications that Lisa touched on in her speech. So what we get to do now is our panel discussion, and we have a great set of panelists. Chris listed them out for you very quickly. The first up will be Laura Hogshead, who's the Deputy Chief of Staff for Budget and Policy at HUD. She is someone we've worked with since she started and are really pleased is at HUD helping to make this process go as smoothly as it does. She's also a North Carolinian and seems to be suffering from some sort of sadness over a recent sporting event with which I am not familiar, but others have been talking about at great length. So hopefully the budget conversation will be enough to help bring her out of that funk and bring some more excitement to our day. So with that, let me turn it over to Laura.
Thank you so much, Ethan. And the excuse, maybe I can use the excuse of a very late basketball game for any mistakes I may make in this presentation. But good afternoon and good morning, depending on where you are.
Great, thanks,
I hope this is not going to be terribly boring. I'm going to walk through the presentation that we did the day the budget came out on February 2nd. I'm going to fly through a couple of parts of it so that we can get to questions later on, and this may be information that you have already absorbed a lot of. So we're going to go through the overview, which is just basically talking about the HUD budget in the context of Secretary Castro's 6 vision statements. Basically, everything we do falls in these 6 vision items, and we want to make sure that we look at our budget and we make decisions based on our vision, on his vision for HUD. And then we want to talk a little bit. I think you probably have absorbed a lot of messaging from the administration about what this budget does. It helps working families feel more secure, of course. It ends the harmful cuts known as sequestration, which I know we'll talk a lot about through this presentation and others, and it puts our nation on a more sustainable fiscal path by including tax incentives and tax changes, ultimately adding up to $1.8 billion in deficit reduction. So that's the larger picture. Let me talk about HUD for a little bit. In terms of HUD's vision, these are the 6 items that Secretary Castro laid out pretty quickly after he arrived at HUD. He wanted to make sure that we were making our decisions in a way that met his vision and shaped every decision from here on out. So I've left them in here because this, I think, is a handy way to think about HUD's budget. Number 1, and there's a reason it's number 1, and I'll talk a little bit more about that, is building a stronger HUD. It's how we do our work, which may not be the most relevant thing to the work that you all do, but it helps us to help you, and it helps us to help our residents. As the stronger we are, the better our programs are. We always want to work to help secure quality housing, whether that is rental or home ownership. We want to make sure that we are ensuring that all Americans have access to quality housing. We are, of course, famously ending homelessness. We're actually making really good progress on that front. We are strengthening all communities, and a note about this, because I know we've got a nationwide audience. Secretary Castro frames this as strengthening all communities in this century of cities. That does not mean that HUD is only focused on cities. It means that most of our population growth over the next couple decades is purported to be in urban areas. That's going to affect everybody, not just the urban areas. It's going to affect our rural partners, everyone out in the country, our suburban partners. It's going to affect everyone to have massive population shifts, so we want to make sure that we're ready for that. We want to level the playing field by making homeownership affordable and by also ensuring that our housing is free from discrimination. And then we are continuing to address climate change and natural disasters, as always. We always are involved in any natural disaster cleanup. So on the next slide, you'll see why we like this budget. We're required to say every year that we like it, but we mean it a little bit more this year. It's good to know friends over at OMB. We have an 8.7% increase over the FY15 enacted level. That's approximately $4 billion. We're very happy to see that blue line going up. You can see that it's relatively flat from FY14 to FY15. So this is a big jump for us. It is the highest level we have requested since the start of this administration, and it will allow us to advance our opportunity agenda and create a solid foundation for years ahead. As Ethan noted, 84% of this is already taken up with renewals. So you will note that the jump may not feel like as much of a jump as it looks like it might on this chart, because renewals go up every year. Rent goes up every year. Cost of living adjustments go up every year. So while we are very pleased to see a very big increase, it is not going to cover everything we would have hoped and wanted from this HUD budget. I'm sure you guys feel the same way. To the next slide, we're talking a little bit about building a stronger HUD, and I thought about taking this out, but I thought it might be helpful for you all to know what we're working on. It's just in terms of our internal operations. We're working on information technology, making sure we've got the right folks in our, we're paying salaries and expenses, we've got the right experts in the building, and that we're moving to shared services, quite frankly, for the stuff that we don't want to do anymore, the transactional stuff. So on information technology, the stronger our systems get, the more information we have for you and for Congress, the better able we are to answer data requests, the better able we are to give information to partners like NHC to do research, the better we all are in the long run. We talk to Congress a lot about the need for our programs, but often our IT systems they don't allow us to talk as efficiently as we would like to. They don't speak to each other, so we're working hard on that. In salaries and expenses, we have requested a large increase, $110 million over FY15, to make sure that we are able to hire the people we need to hire to run these programs, to do proper monitoring, to carry out our priority initiatives. In terms of shared services, I mentioned this as stuff we don't want to do anymore. It's a little bit technical within the building, but frankly, what we're really good at HUD is mission. What we're not great at is paperwork. And so some of the things that we're doing is going to a shared services model with other federal agencies. So the Department of Treasury is going to be doing our hiring from now on. We are moving our core financial systems over to Treasury as well, because we have several different systems that don't talk to each other. We're moving to one model over at DOT Treasury, where we can have all of our systems talk to each other and we can pull data, as I was saying. So this is just about us getting stronger so that our programs get stronger. Now we'll talk about the stuff that's really interesting, which is, first and foremost, we're really happy about the 67,000 new tenant-based vouchers to restore the hole that sequestration left. So we've been working hard for the last couple of years, as have all of our PHAs, to make sure that we get back the opportunities that were lost in sequestration. This budget is very specifically putting 67,000 new vouchers on top of full renewal of all current vouchers. And they're split out in several categories, as you can see. Frankly, the easiest thing to do is to just put 67,000 vouchers into the system and push go. But we wanted to be more strategic than that. We wanted to make sure that we were targeting them to the populations that we want and need to serve. So we've got 37,000 vouchers going for need-based vouchers, and that's where public housing authorities are going to adhere to a standard that PD&R is going to come up with over the next few months to show relative need. So we don't want to put a voucher where it's not the most needed. We want to put the vouchers where they are the most needed. We've got 22,500 new vouchers for homeless families, for veterans regardless of discharge status, and for Native Americans. I think most of you know that in FY15, for the first time, we got the opportunity to serve Native Americans through a form of HUD VASH. This is a continuation of that because we only got it for 1 year. We want to make sure that we're learning the lessons from regular VASH and from VASH on tribal lands, and we're continuing that effort. In terms of veterans, this is an important policy change for us and for the VA. The VA has agreed that in the context of serving homeless veterans, we can serve regardless of discharge status, and that's an important distinction for us because the reason you were discharged from the military 3 decades ago may very well not be valid anymore. And we want to make sure that we're touching those homeless veterans that served, regardless of why they left the military. We have almost 5,000 new vouchers for victims of domestic and dating violence, and 2,600 new family unification vouchers. And on this, I would say we are also asking for legislative language to make sure that youth that are graduating from the foster care system are eligible to use those vouchers for 5 years instead of the 18 months that is currently required. We want to make sure that PHAs can administer all of these wonderful new vouchers. So we have a 90% proration, which is $2.02 billion for PHAs. That's informed by the preliminary results of the admin fee study, and so we're happy that we're able to, if you put out a study that says they need 90%, you better come up with 90%. So that's what we wanted to do with this budget. We also have increases to the capital fund and the operating fund, which we know are desperately needed. The operating fund proration in this budget should be around 86%. We're also, of course, funding housing for persons with disabilities with 700 new units and fully funding Section 202. And then this was a topic of much discussion last year at this forum. So you'll know that last year in the project-based rental assistance, we took advantage of a fiscal year to calendar year shift, which artificially made it seem like our costs were lower for 1 year. And what I promised you then, and I think I told you you could bring tomatoes to throw at me this year, is that we would really ask for what we needed in FY16. I know folks were concerned that we would try to be cute on this. This is what we need. So this is 12 months of funding for project-based rental assistance, January 1st to December 31st. It's a much more stable way of funding this program, and we're not playing any games with this. So again, it helps to have someone over at OMB who understands this very, very well, and perhaps made this decision last year. So we're lucky in that regard. On the next slide, on ending homelessness, we have asked for an enormous increase, as we always do, for homeless assistance grants. We hope that Congress will take us up on it this time. So it's $345 million above FY15 levels, which will fund 25,500 new permanent supportive housing beds. That's specifically for folks experiencing chronic homelessness. And that's exactly what we need. This is a program where we have a lot of good data, and we know how many beds we need to achieve the goal. That's how many beds we need, but we know that because we did not get that funding last year, we have to push the goal back. So recently, the U.S. Interagency Council on Homelessness, in consultation with HUD and the VA and with OMB, decided to push back the goal to 2017. It was 2016. We are confident we can make it, but we always need those resources. We're also funding 15,000 rapid rehousing interventions for families, and that's in order to start working on that goal of ending family homelessness by 2020. As I said before, we are extending those tenant-based vouchers, those new special 67,000 vouchers, to families at risk of homelessness, veterans, and Native Americans. On the next slide, we talk about some of the community work we do. This is kind of in the other bucket that Ethan talked about, the other waterfall. We have asked for choice neighborhoods at $250 million, which should allow us to fund 5 to 8 implementation grants. Those are the grants that are up to $30 million each, and approximately 5 to 10 planning grants, which are traditionally more around the $500,000 mark and help get communities ready. We're asking for authority to expand moving to work to up to 15 high-capacity PHAs over the next 3 years, and we're working a lot with Congress on language and making sure that they're comfortable with that. This is something we've talked to Congress and to a lot of you about over the years. While we did get the increase for the RAD cap to 185,000 units last December in the appropriations bill, we're now asking to eliminate that cap entirely because we already have 185,000 units on the waiting list. And we're also asking for $50 million to provide funding for those deals that aren't quote-unquote free. Right now, all the deals that are happening are moving over their capital and operating fund into the deal. That doesn't work for every unit out there, so we're asking for $50 million to put into those deals too. As Lisa talked about, we're very proud of Jobs Plus, and a program that has traditionally been around the $15 or $25 million mark is now requested at $100 million because we know it works. And that's just as simple as we can put it. We know that this works. It's been thoroughly researched. And so it has a huge increase this year, an $85 million increase. And it also allows that Native American tribes could also participate for up to $15 million. And certainly the Secretary has traveled to several areas. He went to North Dakota and South Dakota early in his tenure and knows how important those funds are. We also have an increase for FSS, as Lisa talked about, of $10 million. So we're trying to do everything we can to make sure that our residents have every opportunity to move out of our housing and onto other bigger and better things. So the next slide talks a little bit about more of this community work. We are proposing greater flexibility for CDBG to encourage folks to work together across regions, and we want to make sure that we have lots of administrative savings and flexibilities in CDBG. So we understand that we're not asking for as much as folks would perhaps want us to ask for. We want to make sure the program is as efficient and as effective as it can be with the dollars we've got. Within CDBG, within iCDBG, I should say, up to $10 million is included to attract and retain high-quality teachers in Indian country. This is an issue that has been identified across the administration as a problem in Indian country, and we want to make sure that we're doing our part to help solve that problem. In addition, the Secretary being a Texan, was very interested in increasing the set-aside for colonias for Texas, New Mexico, Arizona, and California to up to 15% to allow more funding to be directed. Right now, the cap is 10%. And then the administration is proposing an upward mobility project, which would allow up to 10 states, localities, or consortia to blend their funding across HUD and HHS programs. 4 programs in particular: Home, CDBG, Community Services Block Grant, and Social Services Block Grant. So they could combine those funds, apply for funds through HHS, so this is a jointly administered program, of up to $300 million a year in order to carry out projects that are grander in scale than perhaps your yearly allotment of Home or CDBG would allow. We are also making sure that we are leveling the playing field, as we discussed. You guys have read a lot about the decision that was announced in January to lower the mortgage insurance premium for FHA mortgages. We've already seen a good response to that. Certainly the Secretary didn't have a whole lot of fun testifying about it last week, but believes very much in the mission of it. So in reducing the mortgage insurance premiums, we're anticipating that we will help nearly 250,000 new homeowners over the next 3 years, and we will save them an annual amount of about $900, which is a significant savings. We also are requesting the FHA administrative fee again of $30 million, and that's primarily to enhance our IT and administrative contract work. We are ending the year in a healthy balance. We project that we will have a positive end-of-the-year capital reserve balance of $18.8 billion. The growth has been $21 billion over the last 2 years, so we're very pleased by that. And then we're also continuing to fund housing counseling at $60 million, which is 28% more than last year's amount of $47 million, to make sure that folks, once they've gotten that FHA loan, can stay in that FHA loan. So we're happy about that. We don't have specific dollar amount increases in for climate change and natural disasters, but we are continuing to spend the Superstorm Sandy money from a couple of years ago. So of the $15.2 billion that we received in response to that disaster, we've allocated all but $1 billion of it. The last $1 billion is for a national competition in order to spur innovative solutions to planning and resilience across the country. We have asked for a couple of language requests, a pay-for-success demonstration that will not be a surprise to you. We've asked for it before, and a utility conservation pilot. Both of these are an effort to increase energy efficiency in our units. So I think that runs through most of what we've got as the basics of the HUD budget, but I'm certainly available for questions later in this process. Thank you.
Great, thank you, Laura. And I see folks are already putting questions into the question box, which is exactly what we want you to do. That's great. What we're going to do is let each of our speakers go for just a few minutes, some introductory remarks. Then we'll have a moderated discussion. And what I'll do is try and draw on all the questions that you're typing in to direct them to the panelists and try and get as much covered as we can in the time available. So it's great. Put in your questions as we go. If for some reason they don't all get answered now, you can reach out to folks, all of our speakers afterwards. All of their Twitter handles are also on the slides that you'll see with their bios, so you can hit them up that way too. That's always fun. So next is a speaker who I have known for many years, and I'm really pleased to join us, Gary Heigl, who is the Chief Placemaking Officer at the Michigan State Housing Development Authority, or MSHDA. I knew him back before my NHC days when he was the interim executive director at MSHDA. And I know that he has an incredible perspective on what a state can do with the resources at its command and the challenges it faces. So with no further ado, I'm going to turn it over to Gary. It's all yours, Gary.
Thank you, Ethan. Hello, everybody. Great presentation by HUD. They are a tremendous partner of ours in terms of working together. She talked a lot about what things they're doing for their programs. So what I have provided you is MSHDA's 2014 production, because it's a great way to look at how that money that is provided by HUD actually gets into implementation of projects. What I'm going to also point out, when you look at our production, you'll see that some of these resources are not from HUD, but they're from Treasury or from the Department of the Interior. And what I've provided is actually the name of the program. It's not necessarily how we might call it, but as you'll see the production in 14 and the number of units we created. So it's tax-exempt multifamily rental bonds, low-income housing tax credits, mortgage revenue bonds, and mortgage credit certificates. All of those come from Treasury. Then you have home. We use it for both community development and rental development. I'll get into that a little bit later. That come in CDBG, emergency shelter grants, housing choice vouchers. Those all come from HUD. And then we have federal historic tax credit, which comes from Department of the Interior. And then Nsp Program income. That's the Neighborhood Stabilization Program, where we receive funding from HUD. And then Help for Hardest Hit, which is a Treasury program, and then what MSHDA puts into the pot, which is about $37 million almost on an annual basis. I'm sure all of those who are listening, you know that there is at least one there's a state housing finance agency in every state. Many of them look like MSHDA. They're multi-purpose. We work very closely with other state agencies in Michigan. We have relationships with the economic agencies and the human service agencies. We also work in partnership with developers, realtors, nonprofit organizations, local governments, and we couldn't do what we do unless we had those partnerships. It's really how we connect the dots in various programs that makes it effective, especially in today's economic climate. So, for example, the tax-exempt multi-rental bonds, that program is we sell tax-exempt debt. We use it to provide mortgages to build affordable rental housing, 50 to 150 units, but that's never enough. Every tax-exempt deal usually has 4% low-income housing tax credit in it to help build more equity. But we also use home as a gap financer to help build a gap in those projects. And frankly, we wouldn't really be financing any projects if it wasn't for home. We also use the project-based portion of housing choice vouchers. As you can see, we have about 27,000 vouchers. We're allowed to use at least 20% of them for project-based. These all help us fill the gaps in terms of developing these projects. And I'm sure the way it is, especially in high-cost states, when you're seeing, and we're starting to experience this in Michigan, especially in Detroit and Grand Rapids, is gentrification. As the markets get stronger and there is greater demand, we're seeing for rental housing, what we're starting to see is people being outpriced of living in those areas. And so Mayor Duggan of Detroit has recently called for more affordable housing. And one of the ways we do it is we'll work is our programs, because they not only have an economic impact about creating rental housing, they also provide affordable rental housing and really helps people who are in those areas. We use home community development and CDBG. It's a big part of our rural development program. These are areas where it's much more difficult to finance a tax-exempt loan. So what we do is we use them to do things like rental rehab that comes from the CDBG program, especially in our smaller cities where we're still seeing some market demand, but it's 2 and 3 and 4 and 5 units at a time. And so what this allows us to do is do second-story, third-story loft development for rent, and that's been real helpful in populating downtowns. It not only helps to house people with lower incomes, it's a great economic stimulus. It helps to balance out the income on those kinds of properties, but it really helps to create jobs too, and that's always a big thing. We use emergency shelter grants, and here's a place where we get about $3.6 million from HUD through their homeless shelter grant program, but we match that with another $3.6 million from MSHDA money. This has been a tradition for us. We were actually financing homeless programs 20 years ago, and what we're doing now is the governor has recently established by executive order our homeless steering committee, of which MSHDA will chair. This is something that came from HUD. We've had a steering committee for many, many years, but it wasn't official, and so I think where HUD provided guidance is it would make a lot of sense if this was officially done either through the legislature or the governor's office. This really creates a lot of partnership with other agencies who also have concerns with homelessness. So you bring in the Department of Human Services, you bring in the Department of Corrections, bring in the Department of Community and Mental Health, and these are the kind of things, as we're working together, how we can really address the homeless program, the homeless problem. For us, we work very strongly with our continuums of care. I'm sure many of you do the same thing. And it's a great partnership, and it's a great model. It encourages all homeless shelters and homeless providers to work together. They do a lot of the research, look at what the needs are, and then they counsel us on where we should provide the money we have. They're also very helpful in providing us guidance on our supportive housing program that we fund through either direct lending, the tax-exempt program, or through low-income housing tax credits. In the low-income housing tax credit program, it's the only program where we will provide the 9% low-income housing tax credit program, where we will provide either home funds or housing choice vouchers to a 9% deal. That's a policy objective for us because of the increased cost. This is how we help break down that cost. So that's how we've been attacking homelessness. The Nsp program, I have to say, was an incredible savior for us. I mean, it came along at a time when we were having real challenges in our communities, and we got a very large allocation from HUD. It was $225 million. They gave us a very, very stringent guideline. We were really challenged, but we did get through it. They were great partners helping us through it. And now what we're doing is we're generating approximately, this year, or in 2014, it was about $2.8 million in program income, and we're using that in a variety of ways. A lot of it is being put into demolition and blight, but some of it's being used to shore up some of our projects. Another important program for us has been Help for the Hardest Hit. This does come out of Treasury, but we've been using it not only to help people with mortgage problems, but we've taken about 25% of the funds to use it for blight reduction in major cities where we've had a serious problem. And so those funds tend to get connected to local city CDBG programs working through land banks. And so that's been a great partnership there. MSHDA's $37 million. We use that to supplement a lot of the work that we have been doing with these other programs. For example, we use the tax-exempt bond program in conjunction with 4% tax credits and some MSHDA financing that actually comes from a trust fund we created years ago as a result of financing the old Section 8 production program, in which when those projects were refinanced, those subsidies came to us. So that's been an incredible program for us to be able to continue to preserve existing rental housing and actually provide some revenue to us, which has been very important. We've also used MSHDA funds to provide grants for research and for intermediary organizations like the Community Economic Development Association of Michigan, Habitat for Humanity, Detroit Future City, a lot of these groups that do technical assistance, capacity building with nonprofit organizations, research on what makes sense, and things like that. And it's really helped us to stay in front of what's been really, of housing trends and what's been happening. So and by what we have, we've been able to leverage funding from other state agencies. For example, in our low-income housing tax credit program, the tax credits will fund a portion of the units in a rental development, but the Michigan Economic Development Corporation will provide some of its state funding to fund what's referred to as market rate units, so we have a mixed income, mixed use project, and those have been extremely important in making our communities competitive in terms of continuing to attract people to Michigan, which is, we see as a big goal for us, is how do we repopulate the state's major cities after they lost so much population. And I have to tell you that obviously we have been very concerned about some of the Congress's action in cutting HUD programs. I mean, we will be in Washington in 2 weeks. We'll be meeting, as will all the other housing finance agencies around the country. We will be sitting with our legislators, their staff. We'll be talking about home, CDBG, tax credits, and historic tax credits as an important group of incentives that really help us to improve the quality of life for people and enhance the prosperity, the economic prosperity of our urban communities, both rural and urban. This is probably one of the most important things we do all year, is to support the efforts of what's happening with the federal agencies. So I'll be looking forward to answering any questions people may have.
Great. Thanks very much, Gary. We're going to jump right to Roseanne Haggerty, and we'll do questions at the end. I will do my best to use the time allotted, but I would ask folks who are listening, you can type your questions into the box, and we'll get through as many as we can in the discussion period. But next up, we have Roseanne Haggerty, who runs Community Solutions. You may remember her from past NHC events, like our policy symposium a couple years ago, focused on veterans housing issues. We are really pleased to have her back again, in no small part because Community Solutions' new Zero in 2016 campaign is something that NHC is a member of, and we hope many other folks are supporting, focused on the goals of ending chronic and veteran homelessness by 2016. So with that, let me turn it over to Roseanne.
Hi, everyone, and thank you very much for including me today. Just completely appreciated the terrific presentations earlier, and Laura especially set such a lovely context for knowing the HUD budget details with respect to homelessness. And it definitely is a very positive budget for homelessness initiatives, and with veterans remaining a focus, something that's very important, not just because of the urgency of that issue, but we think that this is such a good way for us to demonstrate collectively the impact of a targeted effort at a specific group of the long-term homeless, and showing that we actually collectively can solve these problems. And so just as a bit of a reminder and background, as of last year, January 2014's point-in-time counts, there were just under 600,000, about 579,000 individuals experiencing homeless at any given time, and about 15% were homeless, or just about 85,000. And fortunately, for the first time since we started counting, fewer than 50,000 of the homeless were veterans, so real progress has been made. And that's the background and the setting for a new initiative that just began at the end of January, in which NHC and many partners have played critical shaping roles. And Zero 2016, as Ethan indicated, is really a sprint. It's about getting the participating communities to zero veteran homelessness this year and zero chronic homelessness by the end of 2016. As Laura mentioned, in terms of the overall national goal, that deadline's been extended to 2017, but these communities, the 71 we selected, really are still willing and prepped to be the trailblazers to show that with this disciplined collaboration, using data, targeting resources, that we can actually show in about 30% of the continuum of care in the country that this goal is achievable. And so advancing to the next frame, and I don't have control of the slides here, unfortunately, but thank you, Rebecca, for your help. As I mentioned, we are working with 71 communities who were selected based on an open application, and the criteria was, are you prepared to pull together the critical local team, which consists of the VA, public housing authorities, mayor's office, or local. Are you prepared to target your resources at the chronic and veteran homeless in the community, use a housing first policy across the boards, share data transparently for learning, not judgment, so that we can all get better at this together, and to use a performance management system to coordinate resources and fundamentally demonstrate the promise of, if we were to optimize our resources, how much more can we get done with the resources that we already have. And within the 71 communities are everything from major cities to 4 entire states that applied together, which is very exciting. That's Connecticut, Rhode Island, Utah, and New Mexico, plus the District of Columbia. So we have quite a range of settings to be working with and to support. And I'll highlight those 2 other goals too, which is, not just to get these communities as the vanguard to that critical path of getting to a functional zero, which I'll define in a moment, but really to prove that it can be done. Essentially, run the 4-minute mile and show the way for other communities who certainly share this goal, and to leave behind systems of coordination, of performance management, and resource optimization that can help everyone who's experiencing homelessness into stable housing. Next, please. Next slide. Back a slide, I'm sorry. So the key strategies here are knowing people by name and then accelerating, improving the work that people are doing in communities to combine their resources and house chronic and veteran homeless individuals in using the tools that can help communities both improve their own performance and learn from other communities. The key evidence-based intervention, as I mentioned earlier, is the housing first, and the idea that we're not going to get individuals into a stable situation by first requiring people to become compliant with health or mental health or substance abuse regimes, but to focus on housing first. And our team of 18 is spread around the country and supported by critical partners, not just NHC, but Rapid Results Institute, Corporation for Supportive Housing, and then NAH and the well, it's a long list, but in terms of the on-the-ground coaches, these communities who are participating will be provided with the kind of data analytics, quality improvement training, and coaching in their resource optimization that we saw made such a difference in the 100,000 Homes campaign. Next, please. And just a well-deserved shout-out to New Orleans. Already, New Orleans, which is one of the participating cities in Zero 2016, as of the beginning of January, has gotten to zero on veteran homelessness. So this is by no means a pipe dream for any of our communities. The numbers are manageable in any community, and the resources have been provided by HUD and the VA to enable this to happen. And I'll define what functional zero means. We aim to get to a point through this effort and ultimately in the country where every community knows its housing placement rate, that there's a well-functioning housing system, not just good housing programs, but that the various individual parts of a housing system actually are linked and coordinated so that someone experiencing homelessness can be rehoused within 30 days. Ultimately, we want this movement to go farther upstream so people are prevented from becoming homeless in the first place very reliably. But the idea that your community knows its housing placement rate and can within 30 days correct homelessness is the goal that we're reaching for in this definition of zero. So next slide, please. Now, these are the key federal programs that are making a difference to communities. And one of the things that has been such a revelation in having person-specific data, knowing who the individuals and families are in communities who are homeless, what their specific, personal solutions would be, what their ideas, which are usually, incredibly resourceful and creative about what would help them solve their housing problems. Capturing that individual information, what the individual eligibilities are, knowing who needs to be prioritized based on the urgency of health conditions. Those data allow us to use a much wider range of HUD and VA and other federal programs than had historically been used. For instance, we know that across the country in the communities that participated in 100,000 homes, that 9% consistently of homeless individuals qualified for senior housing. So 202 becomes a resource for assisting in reducing homelessness. The 811 program, and then I'll say something that is not a funding program per se, but a very important initiative of HUD's in the last few years has been allowing a homeless preference in the HUD-insured multifamily housing developments around the country with Section 8 contracts. And there have been noteworthy examples. New Orleans benefited from electing to use that preference. In Massachusetts, they've had great success in pulling in private landlords running HUD multifamily insured developments to become part of the apartment supply that are helping communities end homelessness. Again, HEARTH, not specifically as a funding program, but as a framework that HUD has advanced that has required coordinated systems at the local level. Again, this is just the type of insight that is allowing kind of a revolutionary shift to collaboration, which is responsible for many of the gains we're seeing. Then the special needs programs, I'm trusting that everyone knows these acronyms. I'm happy to answer questions later. But the McKinney-Vento funding programs, home, and even emergency shelter grants, which typically we wouldn't see as related to ending homelessness. We've seen communities very cleverly using some of those resources for security deposits and other things that actually help people out of homelessness. A hugely significant part of the progress communities are making on homelessness is pulling authorities as major partners in the effort. And the set-asides and the local limited preferences where housing authorities put those in place are just the definitive solution to ending homelessness in those communities. And then, of course, HOPWA is a very significant tool, as we see that about 5% of the homeless across the country in the 100,000 Homes campaign were individuals experience living with HIV and AIDS. And then, not to slight other federal programs, but the VA has been just an enormous and effective partner in the push to end veterans homelessness. The grant and per diem programs, I think in the best case situations, are not used as just transition indefinitely, but as very targeted transition to a permanent apartment and a well-linked system. And of course, VASH and SSVF have been powerful tools for getting veteran individuals and families out of homelessness permanently, and to enable our application of rapid rehousing approaches to become embedded in the fight against veterans homelessness. So I will stop there, but we are, let's say at this point, just been completing their point-in-time counts. For the first time, many cities who are participating in the Zero 2016 have not just used those as kind of anonymous, kind of estimates and counts, but have used that mobilization in their community to get person-specific information that will actually provide actionable data, enabling those communities to house individuals that they encounter during the count. And that is another push that we think is going to be beneficial to communities in their design of better functioning housing systems, to use any of those efforts to assess homelessness as opportunities for learning specific information that can lead to housing those individuals and families. Thank you.
Thank you very much, Roseanne. That was great. What we're going to do right now is move right along to Rick Gentry, who leads the San Diego Housing Commission. I've known him for years. I'm sure many of you have, as really an innovator in this space, someone who has taken some of the best lessons from private housing development and tried to bring them into the public housing sphere. We're loading up his slides right now, but I'm sure his voice connection is working. There we go. Rick, why don't you take over?
I'll be glad to. Thank you, and good afternoon. And it's afternoon on the West Coast now as well. And in the interest of time, I think what I'm going to do this afternoon is to truncate our slideshow. And I'm only going to do slides number 2, 3, and 4. I think I can cover everything with those and then leave more time for questions and answers going on. I will point out in starting that for anyone who wants more information about the San Diego Housing Commission, go on our website. It is a good one, if I do say so myself. And it is at www.sdhc.org. I'll also point out in opening both to Laura and to Chris, I'm the third native North Carolinian on this webcast. And I'm probably the one that sounds most like I'm from that state. You two have lost your accent somewhere along the way. And I'll point out to Laura that I went to school at Wake Forest, and so I'm always glad to see either Duke or Carolina lose, so I was half pleased with the ball game last night. Let's go now, if I could, to slide number 2. And the San Diego Housing Commission is a little bit of a unique animal in the housing authority world. We were established only in 1979. San Diego was the last major city in the country to establish a local housing agency. And because of that, there are some things about this agency that were set up utilizing lessons learned from some of the others, and it makes it a bit unique. We currently manage an annual budget of over $337 million per year, over 260 employees. Our largest program is our Housing Choice Voucher Program, the Section 8 Housing Choice Voucher Program, and we're serving just short of 15,000 individual households in that program, which is directing more than $140 million per year, not only to help these individuals, but also serves to support the private rental marketplace here in San Diego, which is, as you all may, I'm sure, know, is a very expensive housing market for the country. In addition to the voucher program, the Housing Commission owns and operates, between the Housing Commission proper and a nonprofit wholly owned affiliate, we own and operate some 3,200 units of hard housing units as well. And of those, I'll point out that we have a very small public housing presence. We have currently fewer than 200 public housing units. Most everything that we own and operate is locally owned, operated off local programs, some with tax credit financing, some without. And part of that, a background reason for that, is that in 2007, the Housing Commission received approval from HUD to convert most of our public housing, former public housing, to vouchers. We went through an exercise from 2007 to about 2012 where we converted some 1,165 former public housing units to Section 8 units, and we did so without project basing the Section 8 subsidy, which I think was a pretty gutsy thing for this agency to do at that time. That program has worked very well, and that's a subject for another day, but it precedes RAD, and I call it RAD on steroids because we did, I think, a very good job with it, and it was a very robust program. Anyone who's interested in that, I can answer questions about it later, or you can look it up on our website that I mentioned earlier. In addition to those properties that we own and operate and the Section 8 Housing Choice Voucher Program, the San Diego Housing Commission also is a local housing finance agency. And this was the part of our founding that I think was unique from most local housing agencies. Most local housing authorities are identified by public housing first and Section 8 second. Section 8 is our largest program, certainly. But we also, over the years, have acted as a local housing finance agency to create over another 15,000 units of affordable housing in the city of San Diego. We've done that in a variety of ways, primarily the issuance of tax-exempt bonds, and also utilizing local funds, the local housing trust fund monies, and also the federal home program, which flows through the city and to the Housing Commission. We've used those funding sources as gap financing to help create tax credit finance properties owned by third parties. As you can see by the numbers there, that is a significant part of our presence here. It's not by what we operate ourselves, but by what we help to enable others to operate. Also, a set of programs that are not shown on this website, or on this particular slide on the website, is the Housing Commission is intricately involved in the local homeless programs provision as well. And I'm struck by, in particular, by Roseanne, by what you were just saying. The Housing Commission is an active participant in the community of care. I sit on that board, and that board is chaired by a local city council person who also is a former member of the Housing Commission, and I'll point out that the Housing Authority, which the Housing Commission reports to, is the city council. So this makes local government an integral part of the continuum of care and making those programs work. And in a minute, I'll show you how we've been able to use our local flexibility to increase the Housing Commission's presence and activities in local continuum of care and homelessness programs here in San Diego. And I will point out that if there are two terms that I could use to most describe the needs of San Diego and the needs of the San Diego Housing Commission vis-a-vis the federal government, it is funding and it is flexibility. The funding is something we cannot do without. And in particular, the Housing Choice Voucher renewal funding for the Housing Commission is crucial and critical to the populations we serve. In addition to that, the home program, which flows through to us, some of the CDBG funding, which flows through to us for homelessness alleviation purposes, and also the flexibility granted under the Continuum of Care program, which much of that flows through to us too. So we can go to slide number 3. I'd like to point out just one instance of the Housing Commission utilizing its local flexibility to take federal funding and to combine that with local funding in a flexible way to address what is probably the single most critical affordable housing issue facing the city of San Diego right now, and that is the issue of homelessness. Depending on how you measure it, San Diego is anywhere from the 3rd to the 4th to the 5th city in the country with the most homeless people on the streets. And this is not just per capita, this is in real numbers. We're certainly behind New York and Los Angeles, but beyond that, we may be one of the next worst in terms of the prevalence of the homelessness problem here. The San Diego Housing Commission last November launched a new program which we have termed Housing First San Diego. And what we have committed over the next 3 years is 5 elements shown on this slide. And the first is to award development funds from that pot of flexible funding I mentioned just a minute ago, up to $30 million per year, $30 million total, $10 million per year over the next 3 years to create additional permanent supportive housing. We've also committed up to 1,500 of our federal rental housing choice vouchers for permanent supportive housing. And that's on top of some 1,200 vouchers that we have previously committed in earlier years, including the Voucher program here, to create a permanent supportive housing for the homeless. Third, we are investing moving to work, and I'll just explain that in a minute, federal funds to renovate a local hotel, which we have possession of and which is going to be turned into permanent supportive housing, which we are going to rehab, own and operate ourselves. It'll be for veterans and for aged-out foster youth. We are also going to invest additional moving to work federal funds this coming fiscal year to acquire another property for senior citizens. We've already identified that property. It'll be 130 units, and 20% of that property will be used to address homeless seniors. And finally, we've taken 25 units of our wholly owned local housing, which we are going to use as rapid rehousing resources, fully furnished, through a Funders Together, a local philanthropic organization's contributions. And what we're trying to do here with this scenario is to create a housing commission designed set of programs that will begin to address the homeless in a more comprehensive way here in San Diego. If we go to slide number 4, please. Just to give you an example of how the money works for the first of those 5 action items, if you look at current funding resources, the home monies, as well as the City of San Diego Inclusionary Housing Funding and the Housing Trust Fund, combined with moving to work funds from the federal government, together with 2 ad hoc funding sources that have come together this year, one from the California Local Housing Trust Fund, some $1 million, and another $240,000 from the Funders Together organization here. We're putting together a lot of resources in a very flexible way to address this particular set of problems. Let me end by talking about what moving to work is. Of the some 3,000 plus housing agencies across the country, San Diego was one of only 39 who were governed by what is called a Moving to Work program. And what that means is that there was a law passed on the federal level back in the mid-1990s that would allow a limited number of local housing agencies to experiment with their federal funding streams to come up with new and innovative and more flexible ways of addressing local agencies' needs. We are one of those 39. And having worked in this business for, I'm in my 43rd year now, I've worked literally all over the country. I can tell you that the rules and regs that come out of Washington, D.C. that are designed to affect Greensboro, North Carolina, and Austin, Texas, and San Diego, California, all of which I've lived in and worked at, to address those all the same way, not to mention a New York or a Chicago or a Seattle, are bound to create local difficulties in making them work. So the fact that San Diego is a moving to work agency, and we're able to blend our federal monies in a creative way to serve San Diego and its own unique needs the way we need to gives us great powers here. So I would like to end again with those two words, funding and flexibility. We absolutely need the funding. Nothing would happen without that. But the flexibility to go with the funding is also essential. And thank you all very much.
Thanks very much, Rick. And I think those are two key themes that resonate for folks both in public housing and outside public housing. With no further ado, I want to switch over to our final speaker, Lindemann Delaney, who is one of NHC's valued Board of Governors members. She chairs our connectivity working group. She is an incredible resource to me. She also leads, for her day job, Eden Housing, which is a nonprofit developer of affordable housing out in California. She has a lot to share with us, and I'm not going to belabor the introduction any further. Linda, it's all yours. You may want to unmute yourself, Linda. All right, while Linda is working on the audio connection, I will want to remind folks that you can enter some questions into the question box. We have a number already. I will do my best to get those to the panelists within the time available. If not, we will certainly follow up with folks afterwards. We can do it by email or by Twitter and make sure that they get your questions and can answer them as best they can. Also remember...
Ethan, can you hear me? There I am. Can you hear me?
Go ahead.
Okay, great. Yeah. Sorry, I'm still learning how to use my own headset. Sorry about that. I'll speed talk for you all. Thank you for having me, and I know we have very few minutes left. So Ethan asked me to talk a little bit about how we use the money and why it's so important. So I'm just going to tell you quickly, Eden is one of the oldest nonprofits in California. We got our start in 1968, and we work all over California, predominantly in Northern California. And for those of you who aren't Californians, the map that I'm showing you on the screen right now, which I assume you can all see, is roughly a territory the size of New England on the East Coast, which is where I am originally from, and quite thankful that I don't live there this year, since my sister's mailbox is now invisible. She tells me she has 5 feet of snow in her driveway. Anyways, we are here in the sunny California. We have worked all over the state, and I would say that some of the things that we've done with federal funding, basically almost everything we've done with federal funding, every project we've done has included federal funding. We've developed more than 8,000 units, and we've used all of the programs since we got our start in 1968. We actually have used programs that don't exist anymore, and we still own our oldest property, which was done with the HUD 236 program, and it serves seniors here in Hayward, where we are based. Several of the programs we've used are the HUD 202 811 programs, which no longer exist. I think we won the last 202 in the country last year, and we're opening that project this week. It's 22 apartments for seniors. We had 400 applications, and the only reason we only had 400 applications is because we had to shut off the application process, because at some point it's absolutely impossible to get into housing when you have such an overwhelming demand. We've also used neighborhood stabilization, recently partnering with some of our housing authorities to use project-based Section 8 authority. We use home and CDBG, and we also use the low-income housing tax credit. Here in California, the tax credit fuels more than 15,000 units a year in development. I want to just, sorry, I'm not very good at this. I want to just talk a little bit about a property we just opened in Lafayette, California. Lafayette is in Contra Costa County. It is home to over 1 million people, the county, and we did this project in partnership with the Housing Authority of Contra Costa. They provided us vouchers for all 46 of the units. They are occupied by extremely low-income seniors. We have, on average, the income of the seniors who live in our housing is about $14,000 a year. So the partnership with the housing authorities has allowed us to kind of approximate what the old HUD 202 program used to do for us, which is to create a development that we build and can provide some ongoing subsidy to seniors. By and large, we see a huge demand in the fixed income senior population. When you look at where they're coming from, they're either living in extremely overcrowded situations, they've lost their homes to foreclosure, or they've been, sadly, some of them living on the street. In almost every property we're doing now, we've been setting aside several units for people who are homeless and working very closely with our local housing authorities and our services agencies to help move them to permanent housing. I hope soon to be working with my friend Vic Gentry in San Diego, since we're about to acquire our first property down there. But we are seeing here in California major demand. This property that you're looking at actually used home and CDBG funding. I know the Washington Post hasn't been kind to the home program, but we think it's been one of the most effective programs that we've ever used at Eden. We've invested nearly $50 million and built more than 1,700 apartments here in California. This development couldn't have been done without home and CDBG. Between them, they gave us more than $3 million. Our county in Contra Costa works on a consortium basis, which means all the cities pool their money. It's been enormously effective for us because we're allowed to work with the other jurisdictions and basically maximize the impact of the home dollars. We are California, we are a high-cost area, and I will just end with this. The demand is incredible for seniors and for families. We just opened 75 apartments in San Jose, which is the heart of Silicon Valley, which is really fueling a big chunk of California's economic return to a solid economy. 75 homes had more than 4,000 applications. Again, we were partnered with the Housing Authority. We have people who literally are crying in our waiting room because they don't have a place to live and they don't have a place to go. So we are incredibly supportive of the HUD budget. We're very supportive of giving the housing authorities more flexibility, particularly to work with folks like us. And I will stop there and hand the gavel back to you, Ethan, so you can take questions. Did I meet my 5 minutes?
You did. You yeoman service as always, Linda. Thank you very much. And what we are going to do is, for folks on the line listening, we know there's a bunch of questions. I've been reading them as they come in. I'm going to direct them to the panelists. We will probably run over a bit in an attempt to answer as many of these as we can. So if folks need to sign off, we understand, but we hope you'll stick with us, and our panelists have agreed to do the same, and we thank them for that. So what I'm going to do is my best to combine some of these questions, if I can, to hit big themes, and we'll kind of start general and work our way towards the specific and get as far as we can. One question that I had thought about heading into this and has appeared in a number of those posed by listeners is, where's the new production coming from, right? I mean, folks have been asking about 202, about 811. Gary in particular talked about the role of the low-income housing tax credit and how many of HUD's resources really follow those choices because they need to work so well together. So I'm going to start with Laura, but after that, ask any of the other panelists to chime in. Where does the new production come from, and how should we think about that?
Not a hard one to start out with.
No.
Okay.
Solve it for us.
Yeah. So I'm going to go back to that 84% of the HUD budget is taken up by renewals. So we have limited opportunity with the rest of the 16% of the budget, but we want to make sure that we put it towards the things that we know produce housing. So we've got 700 units allocated with $25 million of new money in Section 811. We've increased home by $150 million because that's one of our best production programs, and we are very happy that the National Housing Trust Fund is going to be turned on, or has been turned on, or whatever the flux we're in right now. The money will start flowing next January. We're very happy about that, even though the estimates are a bit lower than we anticipated. We are also still pursuing the Section 202 demonstration, which will help us define better what works in Section 202 and in production, specifically for 202 units, what keeps housing, primarily a service coordinator study, but it will help us figure out for the right direction to go on production as well. But we're just throwing every extra dollar we can at it, but understanding that with 84% in renewals, it's a very hard mix to achieve.
And just as follow-up, before I let the other panelists respond on this one, when you're talking especially about 202 and 811, HUD's dollars are going for the rental assistance, and the assumption is that tax credits will fund the capital spending tax to create the units.
Right.
Is that right?
Right.
So this is a change from, not from last year, but from sort of the history of the program.
In the past 3 years or so, that's a change for the program.
Okay. So panelists, other thoughts on production?
Well, this is Gary. I would agree with, 202s. One of the things we're seeing is just kind of the campus approach where you do have a tax credit project for independent senior living, but then there's assisted and then a 202 approach. We've got a new project down in Detroit. The other is just a need for very low-income units. And that's where the National Housing Trust Fund could be extremely important. We're just not able to get as low as we need to demand for that. I will tell you the other kind of demand we're seeing is just for workforce housing, which is what the tax credit takes care of with some subsidies, but especially in some of our urban cities, we're just seeing so much more of a demand for people who want to live in urban communities, don't want to buy, just want to rent.
So, Ethan, this is Linda. One of the things that I'd like to just ask HUD maybe to comment on is a little bit about the tax credit. I know in the past the administration has been supportive of serving folks up to 80% of AMI and income averaging for the credits. We see huge demand in California and other high-cost areas for folks a little bit, they can't afford to buy a house and they need a place to rent, and there's no real way to serve them with any of the current federal programs. And
Hi, thank you for call to work. It was supposed to end at 3:30 and people are still asking questions. I have to step into another meeting.
No worries. Thanks,
just
Roseanne.
signaled to Rebecca that I can't stay for the question and answer period since the call is supposed to be over now, but I don't want to leave her high and dry. Is there some way you can get a message to her? I don't know if she's seen the email.
Yep, she hears you. We're all set. Thanks for staying with us as long as you can.
Okay, great. Allow me to hold. Okay. Oh, my pleasure. And so, if Rebecca could just, if any call or any questions get directed to me, she could just take the question, and I will.
You will send them right on. Roseanne, no worries.
So
all right, Linda, back to you. Sorry about that.
Okay. Bye-bye.
Oh, sorry, no worries. I was just asking if Laura could maybe speak to the tax credit and proposals around income averaging that would allow some of the folks that, in that 60 to 80% of AMI to be able to maybe access affordable rental housing. It's a significant issue for us in high-cost areas.
So I can answer by saying I'm not the expert in this. I'm happy to do more research and get back to you. I know we're working with our partners over at Treasury very closely. We had a joint call with them yesterday on tax credit issues, so I'll need to look into that a little bit, but I can get back to you.
Great, thanks.
Yeah, this is Rick. One of the additions we might make in terms of advocacy is to continue to advocate for what I think are perhaps the two most successful affordable housing programs I've seen in my career, and that is the Low-Income Housing Tax Credit Program and the Section 8 Housing Choice Voucher Program. You use tax credits on the capital side or the supply side, and you can get down to a workforce housing level. You've got to have a deep subsidy to go beyond that, and it's where you put vouchers together with tax credits that you can house the same population that has traditionally been housed in low-income public housing. So with tax credits and vouchers, you've got a bit better market discipline on the quality of those properties going forward, and also market mechanisms to take care of capital needs in out years. So I think there is a mechanism. It's tax credits, it's vouchers. They're both very successful. They both, I think, need advocacy to keep them in place, and they allow for a lot of flexibility locally in how they get put together.
Rick, this is Ethan. I think that's an excellent point, and it's a good reminder to us that the tax credit program that works so closely with these HUD resources also needs advocacy, not to just keep it, but to expand it. I mean, the Bipartisan Policy Center's Housing Commission recommended increasing both the tax credit program and the home program by 50% to help really address the great unmet need out there. And, I think that's just a lesson to take from all of this discussion, is how important those tools are when they work together. I'm going to have the panel to change gears here for a minute and start to think about the connection between housing and health. Lisa touched on this in her research presentation at the beginning. A number of the questioners have asked about it. One asking about successful partnerships with healthcare, and that maybe with healthcare institutions or with services in the properties. Another kind of a broader question about using the precedent from the Affordable Care Act to address homelessness almost through a prescription for housing. I'm curious on your thoughts about these intersections, and you can tackle any or all of it in your thinking. Linda, why don't you go first?
So I just think that I'll use senior housing as the best example. It costs a lot of money to put someone in a nursing home. It is a lot more cost effective, we think, to have somebody age in place independently. And so one of the things we've been able to do, when we've been able to create projects like the one I showed you at Belterre, is we bring in service coordination and we access community health resources. And what we've seen when we've been able to keep people healthier and actually work with them to stay healthy longer and keep them out of isolation is that they live till very ripe old ages. We actually have a woman who's 102 living with us in one of our oldest HUD properties. So we actually think that housing has significant impact on your health, and for seniors it's critical, and we actually think it's a budget saver to invest in this kind of housing. On the family side, I'm going to point to Dr. Megan Sandell. She believes that healthy, affordable housing is better than vaccinating your child, and since vaccinations are really in the news today, I think you should really think about, if a kid is living in a healthy environment, they're more likely to be educated and they're more likely to be successful, so investing in the roof really matters.
This is Rick. Let me play off that as well. There's a program on our website called Project 25, which I would refer you all to. And that's because of our moving to work status, we were able to enter into a partnership with the local United Way some 4 years ago. And the United Way targeted homelessness as one of its priority areas. Project 25 meant that we sponsor-based 25 vouchers with the United Way. The United Way then researched and found that the 25 locals who were the most frequent users of emergency medical services, police, emergency room, these homeless folks, and then to the United Way came up with counseling funds. We provided the vouchers, and of those 25 individuals selected, 24 are still in the program. The 25th one passed away, so I'll count that as 100% success rate. The issue for us has been getting the health providers to understand how this saves them money, and we can show numbers that it has. But if there's one area of the country that may even be more complicated than Affordable Housing Administration, it's Healthcare Administration. And I think hopefully there'll be some rationalization of that as the Affordable Housing Program plays itself out.
Laura?
So I would just add that we're seeing a lot more innovation in this sphere on the state side, of course, than we are on the federal side, but there is hope on the federal side. So partly because of my work, because of the work of my predecessor, Jonathan Harwitz, we've had a number of conversations with OMB. This is something that Sean Donovan believed in very, very greatly when he was at HUD and still believes in over at OMB, that the housing and healthcare sides of OMB need to be working better together. We've had a couple of successful meetings where we have shown them the research and we've shown them what we've got. We used to call it the wrong pocket problem, but then it sounded too much to HHS like we had our hands in their pockets, which frankly we'd like to. We'd like to take some of their money, but we're not going to be as honest about that. But we are starting to make some headway, particularly because of the states that expanded Medicaid through ACA. That changes the calculus a little bit. Some of the old arguments that were used against thinking creatively around this space, having CBO think creatively around the space, having OMB think creatively, some of those arguments fall away with the expansion of Medicaid. So we're hopeful there, and we're continuing to work on it.
We're also working on that in California, Ethan. We're trying to consider how we can get the state legislature to get on board with that idea.
Gotcha. Well, I think we have time really for just sort of one big picture question. I know there are a number of very specific ones in the question box. What we'll endeavor to do is get you email answers to those after the webinar. Apologies for not having enough time to cover everything. But I think one thing that's clearly on the minds of some of our questioners and probably most of the folks listening in is, it's easy to be pleased looking at these budget numbers, right? It's harder to be pleased thinking about what's going to come out of the interaction between Congress and the President and stakeholders. Where are we really going to end up? I think there are obviously the political strategy questions involved there, but also the the confidence in the numbers questions for HUD. How confident are you in the FHA receipts, in the estimate of the cost of project-based Section 8 renewal, in key numbers that really affect how this is going to play out? I'm going to start with Laura, and we'll get final thoughts from the panelists, and then I'll turn it to Chris for a wrap-up.
Sure. I would say we're very confident. CBO never sees things exactly the way that we see things, but the progress this year as opposed to last year is that we're sharing a lot more information a lot earlier. So we've already had meetings with CBO. This is around FHA receipts in particular. We're sharing a lot more information than we have been able to in the past. And while neither side is willing to completely show all their cards, we're showing as many of our cards as we're allowed to and hoping that we come to a more similar conclusion than last year. In terms of the cost estimates for vouchers and for project-based, we are very confident in those numbers. This is, while there's a long protracted fight with OMB every year, it's not just about silly stuff, it's also about these numbers, so we feel like they are very vetted and that they are very real.
Great. Closing thoughts? Linda, start with you, and then we'll go to Rick and to Gary.
Well, I'll just wear my California Housing Consortium hat. I think we have been trying to impress upon everybody that we work with at every level of government how critical housing is for this state, for our economy, and for the people who live here. It's really a huge challenge. And so we thank HUD and OMB for being at the forefront of thinking about how important it is to sort of break new ground with some programs, but also to increase production funding for programs like HOME. I don't think we can serve the folks here in our state without these programs, so we're looking forward to encouraging everybody to vote yes on this budget.
And for Rick, I'll point out, as you all know by now, although I'm now a Californian, I'm a native North Carolinian, and I've spent most of my career dealing with very conservative politicians more than I have on the other side. And given the way the Congress has gone, is more and more important that we translate the benefits of these programs to people who may not necessarily automatically support them. And I think we do that by showing how it benefits not only the individuals we serve, but the broader basic economy and communities where we're located in. So I think as we can adapt our message to deal with those with the red states, it may be even more critical now than it has been in the past.
Thanks, Rick. Gary, if you're still with us, closing thought?
Yeah, maybe because I've been dealing with the Congress for about 25 years now and seen them go through all kinds of changes, this one probably terrifies me the most. I have been proven wrong that you can change the mind of an ultra-conservative member of Congress. We have done that primarily with a project down in Battle Creek called Silver Star. But I mean, it's amazing that HUD got an increase this last year, but the Congress is even more conservative, total Republican control. It's got a budget cutting in mind. We're going into the last 2 years of the Obama administration. I'm not sure how much good things really are going to happen. I think our vigilance and our activism has to really be stronger than it's ever been before. The key to that are statewide coalitions. We have a Midwest coalition to address the Ways and Means Committee and the Appropriations Committee from a regional perspective because I think it gives a lot more impact. But it's a full court press.
Thanks, Gary. With that, I'm going to turn it over to Chris Estes to wrap things up for us.
Thanks, Ethan. Thanks again to everybody for being on the phone today, and a special thank you to all of our speakers who joined us by phone, and Laura, who's here in person with us in Washington. We really appreciate your time in sort of making this real, especially for the 50 or so Hill staff we had calling in today. I think it's really important for them to get to hear from people about what these numbers mean and who these programs serve and what happens in communities across the country in these different from different folks in the housing continuum. I think for us, I would say a couple of the ideas that came up today are really the crux of what NHC sees as its work ahead. We truly believe that housing is a bipartisan issue, affordable housing is a bipartisan issue, and Part of it is how we have framed it and presented it to members of Congress and Republicans in particular, and are working very hard to think about how we present this issue and make connections for them that they can see and understand and really see the linkage to a lot of their goals and objectives as elected officials. I think our work in the messaging and framing work that Amy Clark has done here and through our communications hub is central to that. I think thinking about how to link the research and the connections to issues of great importance to communities that Lisa gave you a glimpse of today around health and education and economic opportunity are central to that. But it's also making sure that we are thinking internally about what needs to change within the housing community itself. The first question was really about where the production comes from. I think I can say with a fair amount of confidence that regardless of which party is in power right now or in the next few years, there are no dramatic increases in resources coming. It is just not the framework we're operating under. And so while we are excited to have the trust fund as a new potential resource, we have to really be looking critically at how we are utilizing the resources we've got and thinking about innovation. And I think things like the income averaging within the low-income housing tax credit program is an area we will be looking more at. So that's, I think, a glimpse of sort of how to frame, I think, a little bit of this discussion going forward. We will be keenly involved in sort of working with Congress and with HUD and to get the best results we can around funding for housing programs as part of a broad coalition of organizations and to really work this in a bipartisan manner. But we also realize that the discussion we're having today is really about bigger themes as well. And we look forward to working with all of you and hope you will take advantage of the resources we can provide in that area and some of these bigger questions ahead of us. So thank you again. Thanks especially to Ethan and Rebecca for putting this together. And we look forward to seeing and working with all of you again in the near future.